We do a lot of things in medicine where guidelines are handed out. How do the guidelines come about, and how do those that create the guidelines know that we're doing the right things? That's how I got into research, is my questions were specific to treatments.
Designing a question, collecting all the data, analyzing it, publishing it, and then trying it in my practice the next day. That is all the meat of what research is about, and that is how I know how to provide better care to my patients.
I think the turning point for me to stay in research was when I walked in. Dr. Ben Horn was the one evaluating the study and creating the study design, the researcher. And I got to walk into Ben's office just as he was finding out the results of that study. And so for that moment forward, I was able to really feel like I was impacting people's lives.
I started in research with the National Children's Study, collaborating with Intermountain Healthcare and the University of Utah, and it was a study looking at improving children's health. For the first time in our country, we're seeing children being born with lower life expectancies than the previous generation.
We saw people were being harmed by antibiotic use. And so really kind of what led me into this research is to realize, what do we need to do as a health system to change that?
When I got in medical school in the 1960s, I realized that there was a big gap between what we know about people's diseases and what we can do about it. And that gap can only be filled by doing research.
I've worked here at Intermountain Healthcare for 7 years, and I just always loved being part of healthcare, somebody's life, making a difference.
It's a goosebump kind of moment for me when I get to conduct research with very thoughtful, knowledgeable clinicians and care teams that really want the best for our patients. And that's kind of the reason that gets me to the office every morning.
You get to see, well, does this make it better or worse? You're looking through that for multiple patients, and you actually really get to see those results.
I do it with the knowledge that what I do every day is going to help us make a difference today in the way that we treat our patients.